पर जैसे एक एक दिखाती जैसे है ना.
ओके सर.
ओके ओके चलो थैंक यू. Good afternoon everybody. We're just going to start with the McKenzie method of the mechanical diagnosis and therapy. Today we're just going to cover in the webinar. At the end of the webinar, students will be able to understand the basic concept of the McKenzie, explain the type of syndromes, explain the repeated movement of the testing, explain the treatment option, and explain the progression of the mechanical forces, explain the traffic light guides. Okay, so that we just going to be discussed today in this particular webinar. So now I want to start about how this particular McKenzie therapy is going to be started. McKenzie therapy to be started in 1956. Actually, he just going to be started. But before I just want to introduce about the McKenzie, I just going to tell you one incident. What is happened? One day, Robin McKenzie, he was a physiotherapist. He was working his clinics actually in New Zealand, and he was very busy on that particular day. So that particular day, whenever one patient is going to come to his clinics with the back pain, so that time he was very busy with treating the another patient. So he was not giving the time to that particular patient. So he just tell that patient, okay, you have to just go to that particular car and wait for 5 to 10 minutes. So what patient did, he just gone to that particular couch. That couch was arranged like that. There was the head end was little bit of elevated. And that particular patient was lie down on that particular couch, and he just lie down on the prone position. And he just lie down for 5 to 10 minutes. After completing the Robin McKenzie, his routine work and all these things, after 5 to 10 minutes, then he just came to that particular patient. Patient ke paas aa gaya. Then he just going to ask the patient, what is your problem? So that time patient is mentioned, I don't have any problem at all. So suddenly that McKenzie thought, why this pain is going to be gone actually? Why this problem is going to be relieved? So that time onwards, this incident was happened in 1956. So that day McKenzie ka itna wo din tha, he just going to started thinking how this is going to be happen while putting this particular position for 5 to 10 minutes. So after that, after 1956, this particular physiotherapist is thinking, and he just going to start with the research, and he just going to do all his activities and everything. In 1981, he just gave it a brief about this particular McKenzie therapy exercise. So he at least 25 years for this particular McKenzie exercise. All right. So this is the brief history McKenzie is given. So how this particular incident was going to be started. So that's why I just want to tell you that this is a brief history by the McKenzie. So 1981, he just going to be introduced this McKenzie exercise. And worldwide, this particular exercise is renowned. All the well-known physiotherapists going to be utilized this particular exercise for the back pain, neck pain, and nowadays they are just going to use for the extremity also. All right. So that's why he just 1980 was he just going to start it with the McKenzie exercise. But there are so many misconceptions and everything is out there about the McKenzie exercise that we just going to discuss in this particular webinar also. So McKenzie method was developed by New Zealand-based physiotherapist Robin McKenzie 1931 to 2013. The McKenzie method is classified system and the classification-based treatment for the patient with the pain. So next slide we just going to discuss. He just going to talk about all classification system. He just introduced according to the classification of the syndrome and everything. He just introduced particular specific of the exercise. What is the another name of this particular? He just gave the name of the mechanical diagnosis and the therapy. M&D is worldwide is going to be useful. One name is McKenzie. Another name also nowadays is going to popular by the MDT. That is called as a mechanical diagnosis and therapy. Nowadays we just do the assessment and everything. But McKenzie has introduced assessment as well as the treatment. Both things together for the this particular techniques. Now next question is come as a why McKenzie method is so popular nowadays. Before also it was very popular, nowadays also it is very popular. So there are the few reasons I'm just going to introduce here. Nowadays back and neck pain is a very common. If you see the maximum problem patient is going to come with you in your clinics, all the physiotherapy is going to work. You are maximum seeing the patient 80 to 90% patient you are seeing the and the back pain. Okay, so neck pain and back pain is so much of burden to the community as well as the physiotherapist, because patient is going to come, physiotherapist has to be treat that particular patient, and physiotherapist is spending so much of time for the back and neck pain. So McKenzie philosophy is that, okay, whatever the patient is having the back pain or neck pain, in that patient has to treat himself only. So we are not going so much of time for the therapy, because we are maximum time giving the passive physiotherapy to the patient. So we are giving so much of time to the patient, and patient is not going to learn by himself, and patient is not going to be actively. So McKenzie concept is that the patient to himself. Patient has to involve actively. Education of the patient is very important. The criteria for the McKenzie's first criteria is self-education, and patient has to do himself. That is very important. So we are not giving so much of time to the patient, and physiotherapist can be relieved, and there is not so much of burden to the economy as well as the other criteria also. So that's why he just emphasized it is a philosophy of active patient involvement. That is very is just going to be mentioned, and the education for the back, neck, and extremity. Initially, we just going to come across that McKenzie is only for the back and neck, but that is not like that. It is nowadays for the use for the extremity as well as neck. But maximally, we know people we are using for the neck as well as the back. So McKenzie, why it is useful? Grounded in the finding a cause and effect relationship between the position of the patient, assume while the sitting, standing, or moving, and the location of the patient and result of this position of the activities. Now everybody knows that all the back and neck pain is going to nature the mechanical in nature. Why mechanical pain is going to be more common? Because we are having all routine day unwanted forces. Mechanical forces is going to apply to the neck, and mechanical forces is going to be applied to the body. I'll just give you one example for that. Everybody has to bend your finger backward side, extension side. While holding this particular position, you are just going to be started with the pain, and when you release this particular pressure, definitely you relieve with the pain. Why this is going to be happen? Because here I just given the extra force to my finger to the extension side. So what is going to be happen? My joints, free nerve ending is going to be stimulated, and that will give you the pain. So same thing is McKenzie is going to be explained. When you apply the abnormal forces to your spine, back, and all these things, your pain is going to be started. So he just given the education. You should not apply. You have to avoid the unwanted forces to your back as well as the. So automatically your 50 to 60% pain is going to be relieved. So that he just going to be explained that whatever the forces is that has to be minimized. That is the of the McKenzie. He just going to be explained. Next, he also explained about therapeutic approach required the patient to move through the series of the activity and the test movement to gauge the patient pain response. He just, everybody knows McKenzie talk about the particular movements, direction of the movements. You have to go for the repeatedly movement. So whichever the movements when you are applying to the patient, whichever giving the relief of the pain, that particular movement you have to use for the therapy. Then he also explained about the approach, then uses of the develop the exercise program designed to centralize elevation pump. You just come across whenever the McKenzie talk is going to become, main concept is going to come as a centralization phenomena and peripheralization phenomena. So that also we just going to discuss in the later slide also what is the centralization phenomena and what is the peripheral. Centralization means your pain is going to move distal to the proximal, and peripheralization means your move from the central back to the peripheral lobe. McKenzie is going to discuss about your pain, whatever the movement you are giving to the patient, pain has to move from the distal to proximal. Centralization principle he just going to be applied to that particular movement therapy. Also, McKenzie has methods of centralized pain and move pain from the leg to the lower back. What aims of the McKenzie therapy? To do the McKenzie therapy, because we are doing so many manual therapy. We're just going to do the strengthening exercise for the back, neck. We're just going to do the pain relieving modality. But main concept, main aim of the McKenzie therapy is reducing the pain, is centralizing the symptoms, and it's complete the recovery of the pain. McKenzie is going to more talk about the symptom of the patient has to be relieved. That is very important. He's just going to be explained about the patient. And very important concept is going to become, McKenzie has also introduced prevention step is very important when you treat with any patient, because whenever we are treating with the patient, all physiotherapies, we are just treating the symptoms. We are the cause, we are not treating for the thinking about the recurrence also, and prevention, so we are not thinking at all. Because what is going to be happen with the neck and back pain, whenever you are treating the patient one day, today you are just treating the patient is going to recover within 7 days. But what is going to be happen after 2 to 3 months, patient again is going to come to you. Why? Because you just treated with the only the causative symptoms, or the symptoms only you are treated. You are not treated the causes why this pain is going to occur. You are not treated that particular cause. That's why the prevention concept is very important, as McKenzie introduced in this particular techniques. So in that preventing the step is the education of the patient, encouraging the patient to the exercise regularly, and the self-care. This is the main things you have McKenzie is introduced for the prevention of the treatment. The next, McKenzie has given 4 steps, because all the treatment is having the different steps. So McKenzie also introduced there is a 4 step. In that, the 4 step first is the assessment, then classification of the syndromes, then treatment and the prevention. So each and every step we're just going to discuss in the detail. Because whenever if you see any treatment modalities, anything, assessment is very important. So in that also assessment strategy is developed by the McKenzie, and McKenzie is known for the keen for his observation skill. He was very good with his observation skill, and he just introduced this particular observation skill for his assessment strategy. Okay, so now we're just going to discuss about the each and everything in the assessment. So assessment, what patient is going to come to you, back pain and neck pain, routine assessment, definitely we have to just do whatever the history, whatever demographic data, history, whatever you are taking, that you have to take regularly. But what extra thing McKenzie has introduced, that we are just going to discuss in his assessment strategy. Because all the assessment, low back pain and the neck pain, you are just doing routinely. But I am just going to discuss here what is the separate thing he was doing extra for his assessment technique. And for the assessment, he was just going to diagnose for the what patient is having the back pain, what patient is having the neck pain, what type of patient is having the symptoms, that all these things he's going to discuss about the assessment strategy. So in that, he's just going to introduce data, history of the condition, clinical examination. He's just going to be assess the posture, sitting posture, standing posture. Very importantly, he assess about the movements. In that, he just introduced about the quality of the movement. It is a smooth movement, guarded movement, quality of the range of motion, effect of the provocating pain, in which range patient is having the pain and everything. He just going to be introduced. So that routine assessment he just going to do. Now I am just going to discuss about what and another assessment as McKenzie introduced. In that, he just introduced as a dynamic and static evaluation. That is very important. He just going to introduce in his assessment. So in that, what is a dynamic assessment? That is called as a dynamic evaluation as well as dynamic testing. In that, whenever patient is going to come to you, you have to do the 5 to 50 times movement on the affected area, whichever the pain-free use for the therapy, or whichever the movement is decrease the pain, that you have to use for the treatment purpose. So in that, whenever patient is going to come to you, if just take an example, patient is going to come with a neck pain, in that he just going to introduce the flexion extension movement, lateral flexion rotation movement. In whichever the particular movement, your patient is going to be relieved with that particular movement. So that movement he's just going to be introduced on his treatment session. So that is called as a dynamic evaluation. In dynamic evaluation, going to discuss in the postural syndrome, dysfunction and derangement, that we'll discuss in the later. Then he just another introduced as a static movement. What is static movement? In that, he just given the fixed posture to the patient, and that particular posture he has to maintain for the 5 to 15 seconds. While maintaining this particular posture, if my patient is going to relieve with the symptoms, the symptoms is going to relieve from the distal to the proximal, to my therapist, to my position is going to be effective. So that particular position he is just going to be utilized for his treatment purpose. So these two things he just introduced specifically on his assessment. One is the static positioning, that you have to hold for the 5 to 15 seconds, and second, he just introduced as a movement therapy. That knows we have to perform the 5 to 15 movements. Whichever the movement is going to be pain-free, flexion movement is going to be pain. So that is he utilized for his treatment purpose. So things he just introduced for his assessment strategy. Then very important, next, he just introduced about the Quebec Task Force classification. This classification very very much he is used for this particular in his assessment pattern. What is this pattern? Because initial stage means that we are not having that much of CT scan, MRI, and everything available, and sometimes it's very costly. Only the McKenzie has introduced this particular diagnosis procedure. In that, we can diagnose the patient without the CT scan as well as without CT scan, MRI, as well as in X-ray. Means without investigation also we can assess this particular patient is having this much of problem. According to that, we can introduce our the McKenzie therapy. So this is the Quebec task force. He just going to be introduced to find out for the assessment for the low back as well as the back pain. And if you are not having the facility of this thing, according to this particular Quebec task force, you can introduce particular and we can introduce the McKenzie therapy. So in that, he just going to be introduced as a Quebec. In that, the first criteria is, first thing is indication he just given, pain in the lumbar, dorsal, cervical area without radiating below the gluteal fold and beyond the shoulder without neurological sign. That is the first QTS classification he just introduced. In that, means pain is localized to the back, dorsal area, या तो cervical spine, but it is not related to the thigh as well as the shoulder. Okay. Next, second classification he has given, pain in the lumbar, cervical and thoracic area with proximal radiating but without neurological sign. Very important. In this, patient is having the radicular symptoms up to the shoulder, above the elbow, not below the elbow, and there is no neurological sign. Means there is no weakness, there is no myotome involvement, there is no dermatome, there is no reflexes is going to be involved. Then he just going to indicate pain in the lumbar, cervical and thoracic area with the distal radiation without neurological sign. That is, he just going to introduce third. Fourth is a pain in the lumbar, cervical and thoracic area with distal radiation with neurological involvement. That is a fifth. It is not seen here. And the sixth, he just going to be introduced. There is a compression of the spinal nerve roots confirmed either by the spatial or other medical tests. That is a CT scan, MRI. So we just going to come to know that there is a nerve root is going to be confirmed involvement. 7, he just going to be involvement. There is a spinal stenosis confirmed by the CT scan and myelography. And 8, he just going to be introduced. There is a post-operative status. If patient is undergone for the surgery and less than 6 months, and patient is having the no pain, ya to unsuccessful, that he is given the category number 8. 9, post-operative status more than 6 months. Patient is asymptomatic, no pain or negligible. Symptoms of the pain persistent, spinal or radicular. That is asymptomatic is A and the symptomatic is B. So in that also, if patient is having the problem, that is, he is just given the category of the 9. 10 is chronic pain syndrome, absence of the treatable active disease, has been carefully eliminated the pain and limiting the daily activities. That he is given the 10 category. So he just introduced this QTF task force 11 category. According to 11 category, he just given the indication. Okay, in which category your patient is going to be benefited. So he just given the category in QTF 1, 2, 3. What is 1, 2, 3? If your patient is not having any neurological sign, that particular patient is mostly indicated or the mostly beneficial by the McKenzie therapy. He just given this particular category, and according to that, he just given the, if particular patient is going to fall in this particular category. So 1, 2, 3 category, if patient is not having the neurological symptoms, so that particular patient is definitely is going to indicate it for the McKenzie therapy. QTF 7, 8, 9B and 10 is relatively indicator. While giving the McKenzie therapy, we have to take a little bit of the precaution and we have to give the McKenzie exercise for this particular patient. Means in this particular 6, 7, 8 is all the not much neurological involvement. And he just mentioned 4, 5, 6 is not suitable for the McKenzie. What is 4, 5, 6? 4, 5, 6 is that in that patient is having the neurological involvement. Myotome is going to be involved, dermatome is going to be involved, patient is having reflexes altered. So that particular patient, you should not give the McKenzie therapy. Clear? So this is the QTF classification is given by the McKenzie. According to that, he just classify where the McKenzie is going to be indicated and which condition McKenzie is not going to be indicated. The next is going to come as a contraindication that everybody knows which condition we should not go for the contraindication. That is a malignancy, active infection, acute inflammation of the disease, CNS dysfunction, means patient is having some higher mental function problems, deliberating disease, bone weakening disease like osteoporosis, because here we have to assume the position, we have to do the movement. If bone is so much of brittle, we should not encourage the patient to do McKenzie therapy, fractures and the dislocation. So these are the conditions McKenzie has given. You should not go for the McKenzie therapy. So this is all about the assessment. So assessment में he just given the observation skill is he was very keen. He just given the assessment के अंदर two main strategies, static strategy and the dynamic strategy. According to that you have to utilize. And he just given the Quebec task force, that is for the indication where McKenzie's therapy is going to be introduced. So that is all about the assessment part. So we are having first assessment, we just clear. Next is he just going to explain about the classification. Second thing, classification. He just explain about the, everybody knows about the 3 syndrome, but he just going to explain about the 4 syndrome of the McKenzie. So that 4 syndrome, we just going to discuss each and every area. So what he just introduced, McKenzie described in 1981, the mechanical classification in the McKenzie system. According to McKenzie, pain of the spinal origin can be classified into the 4 syndrome. What are that 4 syndrome? One is postural syndrome, dysfunction syndrome, derangement syndrome, and other on the non-mechanical syndrome. Everybody knows about all 3 syndrome, but he also introduced the 4th one also, that is called as the other and the non-mechanical syndrome. So now we're just going to discuss about each and every syndrome. So what is a postural syndrome? In postural syndrome, all the physiotherapists know what is a postural and all these things. So we're just going to discuss detail about the postural syndrome now. In postural syndrome, pain appears after prolonged static loading, which in turn causes the overstretching and the mechanical deformation of the normal spinal tissue. And the pain eases on the removal of the loading. Already I discussed, if you are sitting for the prolonged time, if you sit for the slouch posture, after 5 to 10 minutes, definitely you start with the pain and everything. Why? Because your tissue is going to be stretched, and because of that, your free nerve is going to be irritated and patient is going to start with the pain. When you assume the erect posture, your pain definitely is going to be relieved. So that he's just going to explain about in the postural syndrome. What clinical features patient is going to come with the postural syndrome? Usually patient will have the less than 30 years of age. There is a sedentary occupation. Patient is lazy. That particular patient is going to develop the postural syndrome. Under-exercised patient. Onset is insidious and the gradual worsening. Whenever insidious means you are sitting for the prolonged time, you start with the pain. But if you not correct your posture, that pain is going to be persistent for the longer time. So that is just going to be explained. Pain-free when the active or the moving. And always it is intermittent. Why intermittent? Whenever assume the odd position, that time only patient will have the pain. When you assume the proper position, patient will not have the pain and all these things. So that is all about the postural syndrome. Next, he discuss about the dysfunction syndrome. What is dysfunction syndrome? In dysfunction, pain appears immediately when the shortened the spinal tissue are stretched. I'll just give it one example. Whenever you are having some tight structure on the back extensor. So what is going to happen when you go for the flexion and range, we are going to feel that there is some stretch is going to be feel. So that everything is going to come under the dysfunction. So here the dysfunction is what? Shortened structure is your dysfunction. Any incision is going to consider as a dysfunction. So he just going to explain about the dysfunction. There is a shortened structure because of the pain. If you go for the opposite movement, patient is going to have the pain. In the dysfunction, patient is having the pain is then the stop on the removal of the end range and the stresses. Mechanism of pain due to the absence and adequate movement, while tightness of the soft tissue, it is going to be occur. Means tightness, the shortened structure in the dysfunction, patient is going to arise with the pain. What are the clinical features patient is going to come across whenever the patient is going to come with a dysfunction syndrome? Usually more than 30 years of the age, poor posture, under-exercise, progression loss of the movement, pain felt at the end range, not during the movement. That is very important. Whenever you are having some incision, if you perform the opposite movement to initial range, you will not have the pain. But when that particular incision is going to stretch with the end range, that time patient will have the pain. So here you need to be understand that patient will have the end range, patient will have the pain. Then patient will have the early morning stiffness and the ease as per the day's progress gradually. then everybody's come across derangement syndrome. Whenever the McKenzie concept is going to come, everybody's talk about only the derangement. It's not like that. Whenever the McKenzie is there, he's just going to be explained about the postural syndrome also. He's just going to explain about the dysfunction, and he's also explained about the derangement. But we're just going to come across the maximum patient of the derangement. That's why in our mind there is a fixed strategy ke derangement syndrome only is treated by the McKenzie therapy, but it's not like that. McKenzie therapy is treated by the postural syndrome also. It is treated by the dysfunction syndrome as well as the derangement syndrome. So what is derangement syndrome? In this pain felt immediately or eventually when there is an anatomical disruption or the displacement of the intervertebral disc. Okay, here I just want to explain, whenever there is a cervical spine or lumbar spine, two vertebra in between, you are having the intervertebral disc, that is called as a spinal unit. Two vertebra and intervertebral disc is called as a spinal unit. Whenever there is a spinal unit integrity is going to be altered because of any reason, that time your patient is going to start with the derangement syndrome. Means any disc prolapse, any collapse, anything is going to be taken place on that particular unit. That time your patient is going to develop the derangement syndrome. When the asymmetrical or unequal loading on occurs, there is a disc produced and causing the pain. So deranged pain because there is a maximum patient is going to come. That's why we just going to McKenzie is only the derangement, but that concept has to be removed today. You need to be understand McKenzie is given all these three syndrome equally up treatment option. Okay, what the patient is going to come with the clinical features whenever patient is having the derangement syndrome. These patients come in between 20 to 55 years of age. 12 to 55 years of age is cervical region, and there is usually patient is going to come with the sudden onset of the pain, disabling type within the few hours. This syndrome is also qualified as classified as a two groups, that is called as a irreducible derangement and reducible derangement. Means sometimes derangement is not going to irreducible derangement means derangement is not going to be treated by the McKenzie therapy. So that time McKenzie has not introduced the any exercise for the irreducible derangement, but definitely reducible derangement, McKenzie is definitely is going to be useful. So you need to be understand while doing the performing the static movement, या तो static position, या तो static movement, your pain has to be reduced in the derangement. That particular patient is going to be indicated for the derangement syndrome. Irreducible derangement, there is no role of the McKenzie therapy. So that you need to be understand. Only the reducible derangement syndrome, your McKenzie therapy is going to be work it out. Next, there is he also explained about the different types of the derangement. So he just going to explain about the 7 type of derangement. In that, what is the first derangement? Derangement 1. In that, patient will have the central or the symmetrical pain across the L4, L5, and rarely buttock or the thigh pain, and there is no deformity. Means here your pain is localized to the cervical spine and the lumbar spine. I'll just going to show the diagram also, so you'll come to clear about all 7 derangement. So in type 1 derangement, your patient is having the pain localized to the only the cervical spine and the lumbar spine. There is no asymmetrical, means एक unilateral side पे ऐसा कुछ भी नहीं होता. It is only the present on the central side के अंदर. What is derangement 2? In that the central symmetrical pain across the L4, L5 with or without buttocks or the thigh pain with deformity and the lumbar kyphosis. 1 के अंदर there is no deformity, 2nd के अंदर central pain with there is a some scoliotic list होता है आपका patient के साथ, कभी-कभी आपने देखा होता है, right neck के साथ patient कभी-कभी आता है, तो that is called as a derangement type 2. What is derangement 3? In that the unilateral asymmetrical pain across the L4, L5 with or without buttock and the thigh pain, and there is no deformity. Here initially 1, 2 is the center pain. Third में he just discuss about asymmetrical, means एक ही side पे right side पे होगा back pain, या तो left side पे radicular pain होगा, and that is not radiating below the knee joint. It is above the knee joint and above the elbow होगा. That is called as a type 3 derangement. Derangement 4 is unilateral asymmetrical pain across L4, L5 with or without buttock or thigh pain and with deformity of the lumbar scoliosis. 4 के अंदर patient is having asymmetrical pain with there is some deformity is going to present. That is called as a derangement 4. Means 1 is central, 2nd के अंदर deformity हुआ, central with deformity, 3rd is asymmetrical, one side right side पे होगा, left side पे होगा, और 4th के अंदर क्या होगा, right and left side along with patient will have the deformity. That is called as a derangement 4. The next is going to come as a derangement 5. What is derangement 5? There is a unilateral asymmetrical pain across the L4 मीन्स यूनिलैटरल हमने थर्ड में क्या किया था, ओनली अप टू द नी जॉइंट था. हियर below the knee joint, if radicular pain is going to be there, there is no deformity, that is called as a derangement 5. Derangement 6, same asymmetrical unilateral radiating pain up to the ankle joint, and patient will have some deformity, scoliosis होगा या तो rhinic होगा, upper limb के अंदर radicular pain up to the wrist joint तक जाएगा. So that is going to consider as a derangement 6. And the last derangement he just going to be explain about the unilateral or asymmetrical pain across the L4 L5 with or without buttock or the thigh pain with deformity of associated lumbar lordosis. That is remaining all derangement in the posterior derangement. 7 is the flexion anterior derangement. Anterior derangement में patient will assume that this particular lock position anterior sides पे, and patient will have the extension में painful होगा, flexion के अंदर relief होगा. That way he just going to talk about the derangement 7. This is a simple diagram you'll just come across. Now you can see the diagram properly. Types of derangement 7 types. First is posterior होगा, central symmetrical होगा, no deformity. सेकेंड के अंदर सिमेट्रिकल होगा पर विद डिफॉर्मिटी. थर्ड के अंदर पोस्टीरियर अबोव एल्बो या तो अबोव नी होगा, देयर इज अ नो सिमेट्रिकल नो डिफेक्ट क्योंकि यूनिलैटरल होता है. फोर्थ के अंदर देयर इज अ डिफॉर्मिटी होगा, अबोव एल्बो होगा. 5 and 6 इज अ बिलो एल्बो एज वेल एज अ बिलो नी. पर फिफ्थ के अंदर देयर इज नो डिफॉर्मिटी, सिक्स के अंदर देयर इज डिफॉर्मिटी, एंड 7 is the anterior derangement. So he just going to be explain about the 7 derangement. Out of that, he just given the category types of derangement. Out of 7, 6 is a posterior derangement. Only 7 is just going to consider as an anterior derangement. So this derangement, why we have to know? Because whenever the treatment we are just going to do that time we have to know that your patient is having the peripheralization symptoms या तो centralized symptoms. For that we have to know this particular derangement. Okay, so clear about this particular derangement. Now we just going to be proceed with the fourth one, that is nobody knows here. There is a non-mechanical syndrome. What is non-mechanical syndrome? Whatever three we just discussed, McKenzie, that is a postural dysfunction and the derangement, that is called as a mechanical type of back pain या तो mechanical syndrome. Another type, he just also given the category in that the McKenzie is not going to be beneficial. That is, he just mentioned about the other, या तो non-mechanical syndrome. What condition is going to come across in the non-mechanical syndrome? In that, there is a spinal stenosis, hip disorders, sacroiliac disorder, low back pain in pregnancy, gynecoepiphyseal disorders, spondylolysis, and the spondylolisthesis. In this particular syndrome, McKenzie is not going to be beneficial much. So McKenzie is going to be beneficial in these three particular syndrome: postural, dysfunction, and derangement. How it is going to be useful? So now we just going to discuss about the treatment. So first we discuss about he just going to be assessed patient. Then he just going to be classified in the four syndrome: postural, dysfunction, derangement, and the non-mechanical syndrome. Now after he just going to assess the patient, he just found कि patient is having which type of syndrome is postural है, dysfunction है कि derangement. According to that, he just planned his treatment strategy. That is called as a McKenzie method of treatment या तो McKenzie treatment therapy. So now we just going to discuss about the McKenzie techniques. So in that, he just going to introduce the 4 techniques. Everybody knows McKenzie is only the position. Some people are know McKenzie only the movements, but McKenzie is not position movement. It is also having the mobilization and manipulation. So McKenzie introduced it in treatment technique position, whatever the position. Everybody's here the concept. Only the McKenzie talk about the extension, but sometimes he is definitely talk about the flexion push. Flexion exercise also. Whenever patient is having anterior derangement, that time you have to go for the flexion exercise. Whenever patient is having the posterior derangement, we have to go for the extension exercise. So it's not like that McKenzie is only, everybody knows here McKenzie is the extension exercise. But here, why patient is our clinic, maximum patient is going to come with a posterior derangement. So that is going to be beneficial with the extension exercise. That's why everybody knows McKenzie is extension exercise. It's not like that. McKenzie is the flexion as well as the extension exercise. According to which type of derangement your patient is having, McKenzie is going to treat. So McKenzie is not only the position also, it is position, movements, mobilization as well as the manipulation. So that we just going to discuss treatment according to all the syndrome wise. So in the postural syndrome, McKenzie talk about you have to remove all the postural stresses, you have to remove postural correction and re-education, and making the patient feel and the pain and the no pain pattern, realize the value of the correct posture. That is very important. He's just talk about in the postural syndrome. So postural means what you need to be remember, you have to remove the postural means forces you need to be removed. Whichever the forces is giving the pain, that particular forces you have to remove. Re-education of the posture is very important and correction of the posture. Then everybody knows here. So McKenzie is also talk about this particular posture correction. In this function, because of the shortened position, what McKenzie is going to talk? McKenzie is going to talk about remodeling of the pathological and the shortened structure by the stretching maneuver. He is also talking, you have to give the movements. That particular movements is going to stretch the shortened structure. And also he's talk about the postural correction also. So in the dysfunction, you need to remember, you have to give the movement opposite direction to the stretch position. That will relieve the little bit of the symptoms. And definitely his maximum talk about the derangement syndrome. So what he's mentioning the derangement syndrome, in that you have to do the examination of the patient's symptoms and the mechanical response to the repeated movement and the sustained position. That already we discussed. Which position is going to relieve the pain, which movement is going to be relieve the pain, that you have to identify, and that particular movement you have to utilize for the treatment purpose. He also mentioned using the repeatedly movement, find the correct direction of the movement for the therapy and the reduced derangement. What is the target here? We are having six derangement for the extension and one derangement for the flexion. Your target, your derangement has to 6 to the 1. So you have your target for the derangement syndrome in the therapies, you have to achieve from 6 syndrome to type 6 syndrome to the, you have to achieve the type 1. And after that, there is no pain. If your types of derangement is higher, patient is having the more problem, and while giving the McKenzie therapy, if it is not going to, your derangement is not crossing from the 6 to 5, 5 to 4, means you are doing something wrong for that particular patient. So you have to think twice before giving the therapy to the patient. Then he's also talk about the direction of the preference, already we discussed. In that, he just going to be mention about the centralization principle and the peripheralization principle. So what is the centralization principle? That we just going to discuss here. In that, he just mentioned the choice of the exercise in the McKenzie method is based upon the direction. Means not only the extension, already I mentioned, there is a flexion exercise, there is extension exercise, along with sometimes patient is having the scoliosis, side shifting हो जाता है. So that time lateral shift of the spine is also indicated. You have to give the movement of the flexion extension as well as the lateral side of the movement is also going to be beneficial. He also explained about the situation of the movement in the one direction will improve the pain and the limitation of the range of motion, where the movement in the opposite direction cause the sign and symptoms to the worsen. If while performing the movement, your symptom is going to move from the distal to proximally, so you can consider your patient is having the centralization phenomenon is present and your patient is going to be improved. But while giving the static position, while giving the movements, while giving the mobilization and manipulation, your patient symptom is going to be worsened. Means पहले back में central में था treatment देने के बाद it is going to ready to the thigh or elbow, yeah it is going to ready to the back leg and the below the elbow. So you can consider your symptom is going to be peripheralized. That is not good positioning या तो McKenzie treatment for that particular patient. So you have to think before giving the movement, position as well as mobilization or manipulation. Your patient has to relieve with all the symptoms. Means symptoms has to go to the centralized, not the peripheralized. So that is given the diagram. All the symptoms has to go from the peripheral to the centers. So now we're just going to discuss about how the McKenzie techniques is going to be utilized. So I'm just going to talk about what are the different techniques is going to be utilized by the McKenzie. Everybody knows here, he's just going to go for the positioning, movement, mobilization, manipulation. So first is discuss about the lying prone. You can see here diagram, you have to make your patient to go for this particular static position for 5 to 50 seconds. In that your patient is going to relieve the symptoms. So you can consider your patient is having good treatment prognosis for this particular exercise. Then this is called as a repeatedly movement. In that you have to ask the patient to come on the elbow. This is called as a dynamic movement of the extension exercise. The next is extension is lying. We have to ask the patient to come on the hand, yeah, the wrist joint. And you have to ask the patient to perform this particular movement in the 10 to 15 times. While doing this particular 10 to 15 times movement, your patient is going to be relieved with the symptoms. So you can understand your patient is going to be benefited. Then last is the next is the extension line with the belt fixation. Here you have to just apply the belt and you have to ask the patient to go for the extension movement. Then next is a sustained extension. Sustained extension means we have to bad end of the head. You have to just go to be elevated and ask the patient to lie down in the extension position. The next is the extension in the standing. In that we have to ask the patient to go for the extension. We have to ask the patient to go for the in the standing position and repeatedly you have to perform the extension movement. Next is the extension mobilization and manipulation. In that you have to do in the neutral extension, prone lying position, or as well as you can go for the elbow position also. You can go for the wrist hand and you have to perform the extension mobilization as well as you have to perform the manipulation also. Okay. Then if your patient is having the some sciatic tilt hota hai, some scoliotic component is there along with the posterior derangement. So that time you have to apply the rotational mobilization in extension and the rotational manipulation in the extension. We have to do the mobilization and manipulation in the extension position with the little bit of the rotation components you have to just going to be add. The next is going to come as a sustained rotation mobilization in the flexion and the rotation manipulation in the flexion. So this is the rotation flexion mobilization as well as the manipulation you have to just do in the supine position. The next also he just going to be introduced is the flexion in the lying, then flexion in the standing, and then he's just going to introduce the flexion in the step standing. And last, very important, sometimes your patient is having the scoliotic tilt, you have to scoliosis, you have to list. So that time you have to apply this particular patient the correction of the lateral shift as well as the self-correction of the lateral shift. You can ask the patient to go for the laterally corrected shift individual himself only. And if patient is not having so much of spasm and all this time, so that time you have to do the, we can take the help, therapists also, we can help the patient and we can correct the lateral shift. So these are the McKenzie techniques you have to introduce with the patient, and this is decision you have to take according to the which type of your patient is having the derangement, anterior derangement is there, posterior derangement is there. Okay, whatever the symptoms, according to that you have to decide. So next is going to come across the dosage. Okay, that is main question is kitna time tak dene ka. Whichever the treatment physiotherapy is given, dosage is very important. So here the for position, if you want to put any position, flexion position or the extension position, you have to keep for the 5 to 10 minutes twice a day. You have to give the McKenzie position. Movement. How many times movements you have to give? There is a 10 repetition per session and 10 times a day. That is very important. What if here we are doing whenever patient is going to come for the back and neck pain, here was just giving the session for the 30 minutes. So this one mobilization we have to give the 10 times twice a day. You can give for the mobilization, and manipulation you have to do only once. That is very important. You need to be understand. So here you need to be remember McKenzie techniques can the 3 hours. For 3 hours, first R is for the postural. If patient is going to come with a postural dysfunction, postural syndrome, so in that you have to re-educate the patient. If patient is going to come with a dysfunction syndrome, you have to remodel the dysfunction. And last derangement may you have to reduce the derangement. Means your centralization phenomena is going to come for the reduce for the derangement syndrome. So 3 hours you need to be remember whenever you are dealing with the McKenzie techniques for the treatment. How to go for the progression, very important. Progression is depend upon the from patient to the therapist generated forces, sustained position to the repeated movements, and the mid range to the end range, and the static patient generated force to the dynamic patient generated force, and the therapist. In that, very important here, patient generated force. Patient itself is going to retract her neck. So that is called as a patient generated forces. Here, patient is going to apply the forces. Here, the patient therapist is going to apply the forces. Okay. So these are the, he's just going to be explained about how to progress with all the treatment. So that he's just going to be explained. Next is a traffic light guide. He's very well going to be explained. Whenever you just come across with any traffic signal, 4 रास्ता पे आप जाते हो तो 3 lights होती है, red light, green light, and the orange light. What is it represent? Whenever there is a red light, you should not give the miss. हम वहां से आगे नहीं जाते. The same thing principle is going to apply. whenever there is a red light, you should not give the McKenzie exercise. Green light, definitely you have to give the McKenzie exercise. And the orange light means we have to take precaution and you have to go for the means that is you have to start with the exercise. So what is a red light? Whenever the red light means patient is having the increase with the pain or the worsen the result. So that time you should not go for the McKenzie therapy. What is the interference? Why this is pain? Everything is going to increase. In derangement syndrome, direction of the movement is incorrect. Whatever the movement you have chosen, if it is incorrect, so your patient pain is going to be worsened. So that time you should not give the McKenzie therapy. What is going to be happening in dysfunction syndrome? If you apply the forcefully, after stretching forcefully kar diya, so that time also sometimes patient pain is going to be increased. So that time also you should not give the McKenzie therapy. So what you have to do that time, give to do 3 days rest, and then again you have to restart the exercise. So that is a red light you need to be remember whenever you are dealing with the McKenzie therapy. Green signals, everybody know green signals means जाने का ही हमको. So whenever in the dysfunction, pain is produced at the end range and disappear when the stretch is released. Means हमने जब stretching दिया तो उसका pain increase हुआ, बाद में relief हो गया, तो that is ideal treatment. Definitely you can go for the McKenzie therapy. And the derangement, pain is decreased or the abolished by the better हो जाता है, तो definitely you have to go for the green signal. The correct movement and the degree of the force has been selected. Continue with the same till the condition resolve or the color changes. And the orange light is very important. In the derangement, pain is produced or increased, but there is no worsen. And the pain and the decrease and abolish is not better. So here main problem is going to occur is your therapist force is not proper, या तो patient force is not proper. So you have to give the proper force, and according to you have to just go for the McKenzie exercise. So this is all about, we'll discuss about the treatment. The first is the assessment, second is the syndrome, third is the treatment, and fourth is prevention. Very important. When you deal with the McKenzie exercise, prevention is very important. And he's also very emphasized on the prevention aspect. In the prevention, his steps of the consist of education of the patient is very important. Encouraging the patient to exercise regularly. McKenzie first slide mein I already mentioned that he's emphasized more on the patient has to do by himself, and the self-care is very important. Okay. And he also mentioned about the patient has to learn to treat themselves using the specific movement and posture, and the same procedure can be used to prevent the recurrence. Okay. So this is all about, he talked about the prevention. I'll just take 2 minutes more here now. So what are the benefits of the mechanical diagnosis therapy? That is a McKenzie therapy. McKenzie therapy is beneficial for the reliable, it is reliable assessment. He is more emphasis on the assessment. That's why it is called as a reliable assessment. We can diagnose early prognosis. This patient का prognosis कैसा होगा, अच्छा होगा, बुरा होगा. That also he is going to talk about. Focus on the self treatment, better outcome, and the prevention of the recurrence. So these are the main benefits of the MND whenever you are just going to go ahead with the McKenzie therapy. So this is explained about all about the benefits. There is also some benefit. It is a cost effective, save the time and money, because maximum time patient is going to do by home also. So physiotherapy session also is going to be decreased. So there is a save time, money as well. There is a free yourself from the excessive therapy session, expensive equipment testing, and the most importantly is we can benefit it from the surgery, because last back pain, neck pain, patient is going to go for the surgery. Whenever patient is going to involve with the neurological involvement, patient has to go for the surgery. So if we just going to diagnose early patient, if we give the treatment, we can avoid for the surgery. That is the main advantage of the McKenzie exercise. Okay. Also, McKenzie method is well research exercise-based approach, assessment, diagnosis, and treatment used for the comprehensive and clinically result evaluation of the patient. Without the use of the expensive diagnosis of the imaging X-ray, MRI से हम जो diagnose करते हैं, that we can do for the McKenzie assessment से भी हम कर सकते हैं. So that's why it is a very cheap and easy to administration exercise treatment method. The treatment principle of the McKenzie method promotes body potential to repair itself and do not involve the use of the medication, heat, cold, ultrasound, needle, and surgeries. So McKenzie exercise is not going to require this heat, cold, and all these things, surgery and all this. That is the main advantage of the benefits of the McKenzie exercise. And this is the last slide. What are the common misconceptions about the McKenzie? There are so many misconceptions about the McKenzie exercise. Everybody knows it is a just series of the exercise. It is only about the derangement, but it is also used for the postural as well as dysfunction. It is only the extension exercise. It is wrong. In that, there is a flexion exercise, rotation exercise, as well as the slide glide also is going to be present. Only about the intervertebral disc. आप लोगों को सबको पता है, only the intervertebral disc problem होगा तो McKenzie is going to be useful. No, it is useful for the postural dysfunction, other condition also. There is also misdiagnosed only about the repeated and the repeated and range movement. No, it is a position, mobilization, movement, as well as the manipulation. Ignore the biopsychological issue. Does not utilize the manual therapy. It is also has the manipulation also. In that you have to do the manipulation also. And it is about only the spinal condition. It is also wrong. It is not only for the cervical as well as the low back. It is also useful for the extremity. Okay, so this is misconception is there for the McKenzie, so that you have to remove from your mind. This is not McKenzie is going to useful for all these things. So here you need to be remember McKenzie is going to talk about the 4 area assessment, very important, then syndrome, treatment, and the prevention. So this is all about the McKenzie exercise. If you have any question, you can ask me.
Yes, anybody, if any of the participants have any questions?
Hello.
Yes, Nirav sir, can you hear me?
If you have any question, you can ask me here.
Nirav, can you hear me? On behalf of Parul Institute of Physiotherapy, Parul University, I, Dr. Dharman, would like to thank Dr. Nirav sir for sparing his valuable time and sharing his immense knowledge on McKenzie technique of assessment with us. Thank you so much, sir. Thank you all the participants, and thank you PU Webinar for arranging this webinar on a short notice period. Thank you again. And Nirav sir, we will look forward to you for many more such webinars and sessions wherein you can share your knowledge and skills with us and enlighten our students with more and more insights regarding physiotherapy and other techniques on physiotherapy. Thank you all of you. Thank you once again to Nirav sir.